Hi, my name is Nicole, and today I'm going to talk to you a little bit about sickle cell disease. I would like to start with a simple explanation of why this disease even exists to begin with. Sickle cell disease happens when someone inherits two sickle cell genes, one from each parent. But this mutation doesn't just appear randomly. It actually developed thousands of years ago, about 5,000 years ago, as a natural protection against the disease malaria. Now, malaria is caused by a parasite by the name of Plasmodium falciparum, which infects red blood cells. Red blood cells are the perfect host for them. But if someone carries just one sickle cell trait, those slightly more rigid blood cells, because of that trait, make it harder for the parasite to survive and multiply within them. So, in parts of the world where malaria runs rampant and is extremely common, carrying the trait actually has helped people survive over generations. That is why sickle cell is more common in people with ancestry from places like West and Central Africa, the Mediterranean, the Middle East, and even India. Basically, areas where malaria has shaped human genetics over thousands of years. Now, this disease itself was first described clinically in 1910, but it wasn't until 1949 that scientists actually discovered the cause of it, which was the single mutation in the hemoglobin gene. That discovery was huge at that time, and because it was the first disease ever explained on a molecular level. Now, the image on the left shows the red blood cells that have been infected with the Plasmodium falciparum. Now, normally, red blood cells are soft, round, and flexible. They're designed to squeeze through even the teeniest, tiniest blood vessels without any trouble, while carrying as much oxygen as they can. But in the case of sickle cell disease, the red blood cells change shape and become hard, stiff, and curved. I like to use the comparison of a Star Trek, a bat'leth sword from Star Trek, because the shape just visually makes sense to me. I mean, these cells become sharp and crescent-like instead of smooth and round, much like a bat'leth sword. Because they're stiff and fragile, these sickled cells tend to break apart much more easily, which leads to chronic anemia. And when they don't break, they get stuck. These cells block small blood vessels, stopping oxygen from getting through. That blockage is what causes the severe pain episodes known as vaso-occlusive crises. And on the left, you can see a blood smear showing just how different sickled cells look compared to normal ones. And on the right, that is the bat'leth sword I referenced from Star Trek. The earliest medical description was made in 1910 when Dr. James B. Herrick documented a patient with unusually shaped red blood cells. Herrick didn't yet know why this was happening, but his observation became the foundation for understanding the disease. And then decades after, doctors knew sickle-shaped cells existed even decades after, but they still didn't understand the cause of the deformity. The tools to study proteins and genes simply didn't exist during that time. So while it was recognized visually, the molecular cause remained a mystery. But in 1949, Linus Pauling discovered that this disease was caused by a mutation in the hemoglobin molecule itself. He proved that this is a molecular disease, making it the first genetic disorder ever understood at a biochemical level. This discovery was a turning point in modern genetics. It was the first time scientists could trace a human disease directly to a change in the structure of a protein. Pauling's work opened the door for everything we know today about genetic disorders, molecular medicine, and even genetic therapies. So understanding this historical progression really helps us to appreciate why this disease is such an important landmark within genetics, both scientifically and medically speaking. We're going to talk a little bit about some of the symptoms that are connected to how sickled red blood cells block blood flow, which is shown in the image on the left. Okay, so on the left, we can see how normal round red blood cells move smoothly throughout a vessel. But on the right of that very image, we can see how sickled cells clump up and form a blockage in those same vessels. This blockage is actually called a vaso-occlusive crisis, and it is the major cause of pain in the disease. On the right, there's a photo of a child with swollen hands. This is a child in Africa. And the swelling of the hands is actually termed dactylitis. It is often the first recognizable sign of sickle cell disease. And it usually occurs between about 2 to 3 months old in infants. This happens when those tiny blood vessels in the hands and feet become blocked with these with these sickled red blood cells. One of the first complications children experience is frequent infections, and the reason for this is because sickled cells damage the spleen early in life. That's why vaccination schedules, penicillin prophylaxis, and close monitoring are extremely important. Another major early sign is chronic anemia. Because sickled red blood cells die much faster than normal red blood cells, children may show fatigue, pale or jaundiced skin, delayed growth of development. And also, vaso-occlusive pain crises can occur even in young children. These episodes can cause bone or body pain that comes on suddenly, and common triggers include dehydration, cold temperatures, stress, illness, and even travel due to altitude changes. So these are all early signs, and these early signs are important for catching the disease. It also helps families begin preventative care, reducing complications, protecting organs, and improving long-term outcomes. Now, because sickle cell is a systemic disease, as we've discussed, it impacts multiple organs over time, mainly due to the repeated episodes of low oxygen and blood vessel blockages. Blocked blood flow in the brain increases the risk of stroke, especially in children, even without major symptoms. Many kids experience silent strokes, which can impact learning, memory, and attention over time. This is why routine screening with transcranial Doppler ultrasounds are so important. Next, the lungs. One of the most dangerous complications is acute chest syndrome. This is inflammation or blockage in the lungs that can feel and look just like pneumonia. It's a medical emergency and one of the leading causes of hospitalization within this disease. So sickle cell affects the kidneys, specifically the nephrons within the kidneys, specifically the nephrons within the renal medulla. Because the sickle cells tend to get stuck within the vasa recta, within the loop of Henle, which causes quite the struggle to concentrate the urine. This basically means that patients dehydrate easily. They may have blood in their urine, and over time, they may develop chronic kidney diseases. Oxygen delivery is severely impacted by the loss of surface area on sickled cells, and as a result, these patients' bones don't always get the oxygen that they need. This oxygen deprivation causes chronic bone pain and, in some cases, avascular necrosis, where bone tissue usually ends up dying due to a lack of blood flow. And finally, blocked vessels and the retina can cause vision problems, so regular eye exams are essential for early detection. Okay, so now I'd like to walk you through how sickle cell disease is managed, because it isn't something that can be treated with just one medication or one approach. Managing sickle cell is really a long-term combination of medical treatments, supportive care, and preventative strategies that all work well together. All right, so let's start with hydroxyurea. It is one of the main medications used. It increases fetal hemoglobin, called hemoglobin F, which doesn't sickle. So when a patient has more hemoglobin F circulating, their red blood cells stay rounder and healthier. This leads to fewer pain crises, fewer hospital visits, and better oxygen delivery throughout the whole body. Another key treatment is blood transfusions or exchange transfusions. These basically help dilute the sickled cells with normal red blood cells. And they're especially important for preventing strokes in children, which is one of the biggest and most serious complications of this disease. Gene therapy is the newest breakthrough that we have. It works by repairing or replacing the faulty hemoglobin gene, the HBB gene, so that the body can start producing healthy hemoglobin again. It's incredibly promising, but right now it's extremely expensive and not widely available. So this is one of those areas where we really see how healthcare inequality plays a role. Now, even with treatment, crises and organ damage can still happen, so supportive care is essential. Supportive care can look like pain management during vaso-occlusive crises, hydration and oxygen therapy, avoiding common triggers like cold temperatures, dehydration, infections, emotional stress, altitude changes, or sudden temperature changes. And finally, preventative care is just as important. This includes routine vaccines, regular monitoring for organ damage, penicillin in young children, and proactive management to prevent future complications. You'll notice that many of these treatments revolve around improving oxygen delivery and reducing sickling. And this is because hypoxia and dehydration both shift hemoglobin toward the sickle form. So supportive care is not just symptomatic, it directly reduces the biochemical triggers itself. All right, let's shift gears for just a second. I would like to shift into something that cannot be separated from sickle cell disease. I feel the inequities that shape how people experience it. This is one of the most overlooked parts of the conversation, in my opinion, but it's also one of the most important. Sickle cell affects mainly people of African descent, and that matters in the context of the United States healthcare system. Even though it affects 3 times more people than cystic fibrosis, it gets a fraction of the support, the funding, and the national attention. Here are some comparisons. There's about 30,000 people in the United States that have cystic fibrosis, whereas there are about 100,000 people that have sickle cell disease in the United States. And yet, cystic fibrosis receives 27 times more funding per patient. That gap is not just a number, it affects everything. Research progress, access to specialists, and how quickly new treatments get developed. A lot of people with sickle cell share the same story. They go to the ER in excruciating pain, and instead of being taken seriously, they're treated like they're drug seeking. That bias delays treatment, and with sickle cell, delays can be dangerous. A pain crisis can escalate fast. There are also far fewer sickle cell clinics across the country compared to clinics for conditions that mostly affect white populations. That means patients often have to travel longer distances and wait for appointments and fight harder just to receive routine care. And the thing is, sickle cell is already a physically demanding, lifelong condition. But on top of managing the actual disease itself, patients also have to navigate and manage stigma, bias, and feeling like they're not believed or valued within the system that's supposed to care for them. In conclusion, sickle cell disease connects biology, ancestry, and lived experience. Understanding where it came from and why it exists has made me see how survival, genetics, and our environment are all intertwined together. While treatments continue to improve, not everyone has equal access, and many patients still face delays, bias, and limited resources. Moving forward, I believe that better education, earlier care, and more equitable health care can make a real difference for families and communities affected by this disease. Thank you.